Hello, I'm Dr. Larry Maxwell. I welcome you to the Globe-athon to End Women's Cancer. As part of our efforts, we are putting together several lectures to promote public awareness and education around issues related to gynecologic cancer. As part of this global effort, we'll be talking today about racial disparities in Asians and Asian Americans with gynecologic malignancies. Our overall objectives for the talk will be to review racial classification, define what the Asian population is, assess the national distribution of the Asian American population throughout the United States, and to identify the incidence of cancers among Asians in America. It's important that we define ethnicity and race separately. When we refer to ethnicity, it typically is categorizing individuals in terms of a Hispanic or non-Hispanic status. In regards to race, there's typically 5 categories that are acknowledged by the U.S. Census Service, and these are white or Caucasian, black or African American, American Indian and Native Alaskan, Asian, and finally, Native Hawaiian or other Pacific Islanders. It's important when we define Asians to acknowledge the specific geographical regions of the world from which those individuals have originated. The U.S. Census Bureau's definition of Asians refers to those individuals who have origins in the original peoples of the Far East, Southeast Asia, or the Indian subcontinent. And this includes Chinese, Filipino, Vietnamese, Korean, Japanese, and Indian. Those people who originate from the peoples of North Asia, Siberia, Russia, Central Asia, which would include Kazakhstan, Uzbekistan, as well as Turkey, and other areas inclusive of Pakistan, etc. These are all individuals that are designated as white. So oftentimes geography seems to be complicated, but racial designation can sometimes be even more confusing. In the United States, there's a great deal of diversity, and in many instances, an individual may not self-designate themselves as being just one racial category. We see that about 98% of individuals in the country claim to be of one race, but there are a little bit over 2% that will designate themselves as being of 2 or more races. Now, I think that this proportion will become even more and more substantially increased. Projections estimate that by 2050, less than 50% of the population will be white. So this means that there will be a great deal of racial diversity that comprises our society. Now, racial disparities research will become more difficult as a society becomes more diverse, such that how can you perhaps do research on a group of African Americans if a substantial proportion of those African Americans have then had families with other race and other ethnic groups. So we know that the racial groups themselves in terms of risks of disease are defined by the environmental factors that are unique to that specific culture and socioeconomic status, and not necessarily at all related to the color of one's skin. Now, the relation between ethnicity and race in the context of Asian Americans is noteworthy. There's about 3.7% of individuals in the United States that are of Asian racial designation. If you look at the U.S. map noted here below, you'll see that the majority of these Asian Americans are concentrated in a few specific metropolitan cities throughout the United States. in the West Coast, Seattle, San Francisco, Los Angeles, San Diego, also in Texas, as well as on the eastern seaboard, inclusive of Boston, New York, Philadelphia, and Washington. Also, Chicago and Detroit have substantial populations of Asian Americans. In terms of the unique cancers that may be more specifically increased in Asians, we have this listed under cancer incidence, as well as the number of deaths attributed to specific cancers for both white and Asian Americans. You can see that in terms of the overall numbers, breast, colon, kidney, liver, lung, and stomach rank in terms of both the white and Asian Americans. And you can see that the numbers differ between the two racial groups. Also, the mortality of cancers also appears to be different, and you can see that for many of the cancers there appear to be better survival rates amongst the Asian Americans and Pacific Islanders. Information from the Centers for Disease Control give us a little bit of a glimpse in terms of the rates, incident rates, according to Asian or Pacific Islander status. And for ovarian cancer, you can see that the incidence over the course of several years from 1999 to 2009 has shown that compared to white, Hispanic, and black racial groups, Asian American, which is depicted here with A, and Pacific Islanders, PI, appears to be much lower level of incidence as it pertains to ovarian cancer than the other racial groups. Likewise, we see that for cervix and for corpus or uterine cancers, the rates of malignancy may be lower compared to other racial groups. Specifically in the context of cervix cancer, you can see that the age-adjusted rate per 100,000 is about 7.1 for Asians and Pacific Islanders, compared to blacks at 9.9 per 100,000 or whites at 7.4 per 100,000. For corpus or endometrial cancer, one can observe that the incidence of these malignancies is lower. This line for the Asians over the course of years from 1999 to 2009 is depicted in blue as much lower than the lines illustrating black and red, Hispanic and purple, white and yellow, and all other races combined in green. Now, there are a number of interesting studies that have been reported in the epidemiologic literature looking at the cancer incidence amongst immigrant populations from Asia. Between 1975 and 2003, there were a number of studies that compared the patterns of cancer incidence among the U.S. Asian American populations, the immigrant groups from Asia, and Asians that were native and located in their native country. The cancer incidence amongst the first generation immigrants was found to be almost identical to those levels of cancer in Asians within their native country, which means that if a young woman migrated to the United States in her adulthood, later in adulthood and as an elderly patient, her rates of cancer, specific types of cancer, are going to be very similar to those of other women in Asia. However, in subsequent generations, second, third, fourth generations, this individual may end up having children and grandchildren. Those individuals end up having a cancer pattern and rates that become more closely aligned with the incidence of these kinds of cancers in the United States. So in subsequent populations, we see lower rates of gastric cancer amongst Asian Americans, presumably because there's lower salted and nitrate containing foods in the American society and culture. Similarly, there are lower rates of liver and cervix cancer in the U.S., presumably because of lower rates of hepatitis and human papillomavirus, which may be resultant from some of our vaccine programs or other environmental factors. Finally, we see that there are lower rates of lung cancer in the United States because there are fewer stoves where there's burning wood and other combustibles in the home. I would like to acknowledge that at the recent meeting of the Society of Gynecologic Oncology this past year, there were several abstracts and research presentations focused on gynecologic malignancies in Asian Americans. This is the first time in many, many years that we've had a focused effort of researchers looking at gynecologic malignancies in this population of individuals. The first abstract that was discussed was an abstract that looked at differences in survival of Asians compared to white patients with epithelial ovarian cancer using the National Cancer Institute's SEER study. And what was identified was that Asian Americans and Asians appeared to have much better survival with their ovarian cancer compared to whites. A second abstract looked at the prognostic significance of ethnicity and age in advanced ovarian cancer. This was a study that was performed by the National Cancer Institute's Gynecologic Oncology group. This study that represented data from a prospective clinical trial showed that Asian Americans and Native Asians have much better overall survival compared to whites with these kinds of advanced ovarian malignancies. This, again, provides validation for the SEER data that was more based on a population type of database. The third abstract that was discussed was that there appeared to be a negative survival impact with patients that had delays in initiation of chemotherapy after their surgery. And this kind of a negative survival impact was more substantially affected within the Asian group compared to any other racial group. So there's certainly precedence for having more timely therapy, particularly in those patient populations that are at the highest risk. And finally, the last abstract that was discussed evaluated a regimen of antiemetic therapy aimed at reducing nausea and vomiting associated with chemotherapy. And this particular regimen that was evaluated was found to be a very suitable option for management of chemotherapy-related symptoms in Asian populations. So this effort really reflects our specialty's interest in the United States to be more attentive to the personalized needs of this Asian population of patients. I'd like to conclude by acknowledging that the Globe-athon to End Women's Cancer is a means of disseminating information throughout not only the United States but globally. I would encourage you to access this library of information, which is by no means definitive, but at least gives you some information that will serve as a start point to be a more informed individual, and ultimately, if you are a cancer survivor, to be also an ambassador for dissemination of information. Thank you very much.